So this is Miss Taylor again. I am playing a dual role of nurse and patient. And my nurse, Eva, is going to instruct me to proceed with identifying my balance through a musculoskeletal examination. And the first part is she wants me to take about 5 or 6 steps with my normal gait. So that's what I will demonstrate, and then followed by 5 or 6 steps with a sobriety test. It's like 1 foot in front of the other. Then 5 or 6 steps with walking on my tiptoes, and then walking on my heels. So Nurse Eva instructed me to show her what I can do. Now tiptoes. Like you're walking in high heels. Now the sobriety test. 1 foot in front of the other. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. And now on my heels. 3, 4, 5. 1, 2, 3, 4, 5. For this next test, this is called the Romberg Test, and my nurse wants me to close my eyes. She's going to have her hands on either side of me and watch my balance and how I sway. So here we go. She says a little bit of normal swaying is good. So the next part of the test Nurse Eva wants me to do is check my spine for normal curvature. She's going to palpate around my vertebral column to accentuate the curvature to make sure it's normal. And if I bend over, she's going to check the back of the spine, and she's going to alternate between inspecting and palpating down my spine to look for any tenderness, areas that are unusual. She's going to inspect for lesions, IV access sites, symmetry, muscle mass should be firm. So that's the important part. She's going to show you how she palpates the vertebral column to make sure it's the way it should be. This is a demonstration of palpation of the vertebral column. Make sure it's normal. Okay. The next part of the physical exam, Nurse Eva will want me to test my muscle strength. So what she's going to do is when I flex, she's going to create resistance. Okay, so here we go, flex. She's going to, now I'm gripping. To demonstrate my strength. And now she wants me to demonstrate my range of motion. So I'm going to reach out in front of me, back, over shoulder and under elbow. And she's feeling for any crepitus, she's checking for any signs of abnormality. Clench, unclench, clench, unclench. She wants me to demonstrate supination, pronation. Supination, pronation. And she's creating resistance while I do that. And now she's going to feel on both sides of my hands the radial pulse. And just pretend that you're seeing two hands of the pulse being taken at the same time. She says it's 2 plus normal plus amplitude, so there's no need to check for brachial at this time. She's looking for rate, rhythm of the pulses. And the same thing in my other hand. She's creating resistance. She's pulling down. Pronation, supination, pronation, supination. And now we're going to proceed to the lower extremities. She's going to test the same thing. The nurse asked me about any discomforts or pain while we're performing these exercises, and I'm okay so far. Here the nurse is examining the lower extremities by palpating down my legs. Okay. And then she's going to create resistance when I lift up, and lift down. Lift up. The same thing when I flex here. It's going to create resistance. Then she's going to take the pedal pulse. Dorsalis pedis. Okay. The last part of the musculoskeletal assessment will include proper documentation. That concludes our physical assessment.